Hello, everyone. Thank you so much for joining today. We're really looking forward to this discussion today on child welfare system involvement during childhood and young adult health and mental health. This is a collaborative effort by the Center of Poverty and Social Policy here at Columbia, the Bentheim-Thoman Center for Research on Child and Family Wellbeing at Princeton, and the National Collaborative for Transformative Youth Policy. This webinar is the third in a series in which we're turning a spotlight on young adults. And today we'll be talking with Lawrence Berger, Tia Dickerson, Yusef Presley, and Cadon Sagendorf. And I'll start by introducing our four participants, and then we'll jump in. Lawrence Berger is the Associate Vice Chancellor for Research in the Social Sciences, the Sheila B. Kammerman and Alfred J. Kahn Professor of Social Policy, and the Vilas Distinguished Achievement Professor in the School of Social Work at the University of Wisconsin-Madison. And his research focuses on ways in which economic resources and public policies affect parental behaviors and child and family well-being. Tia Dickerson completed her PhD in sociology at Howard University in May 2024 and is currently a postdoc with the Future of Families and Child Wellbeing Study. Her research bridges social inequality, family sociology, sociology of race, mental health, and COVID-19. Yusef Presley Jr. is a lived expert and national advocate for child welfare and justice reform, drawing from his own experiences in the foster care and juvenile justice systems. He works to center youth voices in policy change and currently leads initiatives focused on family permanency, mental health, and equitable outcomes for systems-involved youth. Cadon Sagendorf is from Salt Lake City, Utah, where he's currently pursuing a degree in psychology at the University of Utah. Cadon's work is focused on addressing the intersectionality of mental health within the child welfare system, and he works both on the state and national level to drive policy reform and improve outcomes for youth impacted by foster care. And I'm Jane Waldfogel, and I'm faculty here at the Columbia School of Social Work, and I have the pleasure of moderating today's conversation. We'll be in conversation among the panelists for about 30 minutes, and then we'll open it up for questions from the audience. So please be thinking of questions as we go along and enter them into the Q&A box. Please also feel free to put any comments you have in the chat. So Lonnie, let's start with you. Why is it important to study child welfare involvement, and how are you doing that with Future Families and Child Wellbeing Study?
Great. Thanks, Jane. And it's a pleasure to be a part of this conversation. So I want to start by just giving a little bit of background on the child welfare system to sort of set the context for why it's important and how we might study it. So I think the first thing to note is that the child welfare system or child protective services systems is very, very large and far-reaching and expansive system. We spend about $30 billion a year on child welfare services alone, and it has, widespread implications both for children and families and also in terms of government expenditures. And there's a common perception, I think, that relatively few children are involved with this system, that it's sort of an anomalous and non-normative experience. And I want to show you just two slides on some background data on the size of the system to illustrate that it's really a very common experience for U.S. children. So this first slide is looking at the annual and lifetime, so from birth to 18, rates of CPS involvement in the United States. The black bars are per year. The red bars are over the course of childhood. And what you see is about, every year, 6% of kids, it varies, so between 5 and 6% of kids are reported to the child welfare system. So that's a lot, 5 out of 100 kids in and of itself. A little less than 5% are investigated by the child welfare system. About 1% are found to be victims of child abuse or neglect, and a little under 1% have spent some time in foster care in a given year. So that doesn't mean they were removed in that year, but it means during that year they spent some time there. So I would argue that these are relatively large numbers in a given year to begin with, but if we look at over the course of childhood, what we see is it's more than a third of our all children are going to be investigated by Child Protective Services. So we don't have good data on how many are reported, but 1 out of 3 kids, more than 1 out of 3, are going to be investigated. About 13% of kids are going to be found to be a victim of child abuse or neglect, and about 6% are going to be spend some time in foster care during their childhood. So these are really large numbers. And if we go to the next slide, what we see is these probabilities aren't equally distributed across racial and ethnic groups. And so children of color are much more likely to be involved with the child welfare system than are white children. So if we look, I can just, to make the point, if we look at just the white and black groups, we see about 28% of white kids are investigated over the course of childhood. It's more than 1 out of 2 African American or black children. About 11% of white children are found to be victims. It's 1 out of 5 black children. About 5% of white children will spend some time in foster care. It's 11% of black children. So roughly double the rates for black children. It's also worth noting that, this is also overlapping with socioeconomic status and class. So lower income children and poor children are much more likely than wealthier children to be involved with the system. And in fact, the vast majority of the system is low income families. A few other things as far as background. So the system's focusing on really 2 types of parental actions or inactions, a parental or caregiver. So there are things parents do or acts of commission. So this is really physical abuse, sexual abuse, emotional abuse. There are also things that parents or caregivers fail to do, so omissions. And this is really largely child neglect. And these are failures to provide for children's material needs in terms of food, clothing, shelter, medical care. And also, in some cases, their emotional needs. It's important to recognize that acts of omission, neglect, is by far the majority of cases in the system. From 2/3 to 3/4 of cases are involved with neglect, which is relatively strongly linked to low income and poverty. And there's a developing body of research that's really suggesting that low income status is a causal factor in both child maltreatment and child protective services involvement. One other thing that's really important to note is that most families that are reported to Child Protective Services are not initially served, but many return. So 80% of reports will result in a screening, potentially an investigation, a finding around child maltreatment, but no ongoing services. Now, these kids and families are likely to get re-reported in the future and sometimes move further into the system. So I wanted to set a little bit of a context there for why this is such an important area to study. And the one other thing to keep in mind is that the system really has 3 mandates. So the first is to protect and promote child safety. So it's responding to allegations of abuse or neglect. And this is largely through screening, investigation, determining whether children are safe at home. If they're not, can they be kept safely at home through services, either mandated or voluntary? And if they can't, removing children and placing them in foster care. Once children go into foster care, sort of the second mandate kicks in, and that's to promote permanency. So to either get children back reunified with their families as quickly as possible, if their families can create or be helped to create a safe environment, or by statute, if the family cannot return to or provide a safe environment for children, over time to relatively quickly try to move children to another permanent home. So largely, preferably adoption, but also long-term guardianships or kinship cares. And the third mandate is really to promote the emotional, physical, educational, et cetera, well-being of kids who are involved with the system. And I think what's really important to note is much less research has been done on interplay between the system and child well-being. And it's for a couple of reasons. So first, this mandate around well-being has been applied much more generally to kids who are in foster care than the larger body of children who touch the child welfare system and don't go into foster care. So the foster care research has really produced mixed findings on whether foster care helps, hurts kids, depends on the domains of well-being, depends on kids' backgrounds. So lots of mixed findings there. We know very little about the role of involvement with child protective services without foster care, as far as its effects on children's well-being. And that's for two real reasons. So one is that it's very hard to isolate the effects of being involved with the child protective services system from all the other factors in people's lives that are associated with being involved with child protective services, but may also impact child well-being. So these are, factors like income and poverty, parental substance use, domestic violence, family functioning, mental health issues. The second, and this is where the future of family studies comes in, is there's very little data that allows us to study rigorously associations or causal effects of child welfare system involvement with children's well-being. So we have a lot of administrative data on kids who are involved with the child welfare system. The problem is that those are only kids who are involved in the child welfare system. So you have no what researchers call counterfactual or comparison group of similar kids that haven't been involved with the child welfare system. You also, in administrative data, really don't have a lot of measures of children's functioning, their well-being, family dynamics, parents' behaviors, and those kinds of things that are really important to trying to isolate the relationship between system involvement and subsequent well-being. And so the Future of Families study is really just a unique and innovative opportunity to study relationships between child protective services system involvement and child well-being really throughout childhood and now into early adulthood. So this study has followed a cohort of about 5,000 children from their births until most recently, age 22. We're going into the field soon to collect data at age 27. And what we can observe is a host of demographic factors across these children's lives. We can observe parenting behaviors, health and mental health, child development over time, and involvement with the child protective services system. So this is really rare. And so this allows us to see trajectories in well-being before, during, and after child protective services involvement, and account for these family factors, including behavioral measures that are pretty good approximations of maltreatment-related behaviors. It turns out that the Future of Families is the most widely used study to examine relationships between income, material resources, and child maltreatment and child protective services involvement. And it's really opened up new avenues for examining how child protective services involvement and maltreatment separately and interactively might affect trajectories in well-being. It's also opened up new avenues for examining the way public policies may affect involvement with the system. So I'm going to stop there and go to the next panelist, and we can talk more about the research in a few minutes.
That's great, Lonnie. Thank you so much. So let's turn to Tia, who's an expert on mental health. And Tia, can you tell us, how did you get interested in looking at child welfare involvement and mental health, and what are you finding?
Thank you, Jane, for having me here. It's a pleasure to be on this panel. So to answer your question, first off, I became interested in the work in my studies in my PhD program, looking into originally how mass incarceration impacts families. And so within that line of work, I became interested in this research after engaging with the work of a legal scholar by the name of Dorothy Roberts. And it sort of opened my eyes to how the deep and often unacknowledged intersection between race and poverty and systemic inequality within the child welfare system. And so we often hear about how these inequities are reflected within these systems, but it's less acknowledged in how they might impact youth, especially those who are already exposed to adversity in early childhood. And so when I looked at the data, there were patterns that were reflected both in the carceral system and within the child welfare system that are supposed to support families and vulnerable children. And some of the work sort of argues whether, whether CPS is or the child protective system is more harmful or if it's helpful to families, and whether it's reproducing trauma and instability that it's actually meant to address. So this led me to explore this research. And as Lonnie has pointed out, that nearly 40% of children experience an investigation by the age of 18. And so I was really interested in how this shapes the long-term mental health outcomes for them, and how whether CPS contact functions as a protective factor or a neutral event, or even some case as a source of additional harm, especially for those already in adverse circumstances. So in the work with the Future Families and Child Wellbeing study, we took a look at the mental health outcomes for the young adults at age 22. And so with the aim of the study was ultimately to clarify the relationship between CPS contact and mental health outcomes in young adulthood, which is something that is widely debated by family scholars. And so using this data, as Lonnie also pointed out, that it's a longitudinal birth cohort study, which places it at a really great position to really look at these outcomes. And so I looked at how CPS contact is associated with depression and anxiety at age 22, and whether this relationship is shaped by histories of abuse. So here we've compared the rates of mental illness between those with and without CPS contact. And if you take a look, a few things stand out. First, the rates of doctor-diagnosed depression and anxiety are relatively low overall, but we see that individuals with CPS contact report slightly higher levels of depression and comorbid depression and anxiety. The difference is especially notable when we examine self-reported symptoms using the validated scales. And among those with CPS contact, we see that 44% met the criteria for depression using the liberal symptom cutoff compared to 39% without. And so using the stricter conservative threshold, we see that the gap, it still persists. It's 35% versus 31%. And what this suggests is that individuals with CPS contact report higher levels of psychological distress, even if they haven't received a formal diagnosis from a doctor or mental health care professional. But these descriptive statistics can only take us but so far. And so to better understand the mechanism behind these differences, we estimated a few models that included CPS contact, abuse history, and a range of other sort of socio-demographic factors, such as mothers' mental health, and other areas. And so in our model, we found that CPS contact alone didn't significantly predict mental health outcomes in young adulthood, but childhood abuse did predicted. Specifically, we found that physical abuse was associated with an increase in the likelihood of depression and anxiety, and sexual abuse and combined physical and sexual abuse also had very significant effects on mental health outcomes. One of the things that we did in the models, what we called an interaction, to see the difference in outcomes for those that reported abuse and those versus those who had had CPS contact. And what is critical here is that the interaction terms revealed a more sort of nuanced picture, and those who experienced both physical and sexual abuse and CPS contact was associated with additional harm. So there was an increased likelihood of mental health problems by over a point increase. And so that suggests that CPS contact may compound the emotional burden for those who with more severe sort of abuse histories. And this could be potentially due to various factors such as a removal, which can often traumatize youth. There could be inadequate intervention, which could just be due to lack of resources or disruption in caregiving relationships. So these are some of the findings and the disparate outcomes between those who had CPS contact and those who did not. We also found that women were more likely to report depression and anxiety, which is consistent with the larger literature on mental health. And being Black was also significantly associated with lower odds of reporting mental illness in our study. So this finding reflects resilience or protective cultural factors, but it could also signal underreporting and sort of differential expression of distress, which many scholars have noted, and how these scales may measure mental health symptoms in different race and ethnic groups. And so the point here is that it does warrant additional examination. And so just to sort of sum it up, the study contributes just a more nuanced understanding of CPS involvement and youth mental health, and how that shapes mental health in young adulthood. And while CPS contact isn't uniformly detrimental, its effects sort of depend on the context, and that's something that we can explore further in future research. So that sort of wraps up the study. That answers your question. Thank you.
Thank you, Tia. So let's turn now to Yusef and ask, can you tell us about your perspective on these issues?
Yes, thank you for asking. Great work, Tia, by the way. My name is Yusef Presley. It's grateful to be a part of this conversation. So part of a little back history on me, I was adopted at 14. I was in the foster care system, but before then, I experienced homes. So by the time I turned 22, I was dealing with depression, anxiety, and long-term impact of instability. Without always having language or support to name what I was feeling, I never knew, what was inside. This report hit home because it shows what many of us already know. Mental health or struggles are widespread amongst young adults, especially young men. So people like myself, we're often either overdiagnosed or underdiagnosed. But because we're not always seen or supported in ways that we need, that's why I'm here. And I'm here to put lived experience besides the data.
Sorry, I was saying, thank you, Yusef. You were breaking up a little bit at the start of your comments. So I don't know if people heard, you were saying that before you were adopted, you were in a pretty large number of foster care placements.
Yes, over 100 placements, foster homes and placements combined.
Yeah, thank you. And yeah, we'll come back to you. I want to bring Cadon in. So Cadon, can you want to jump in and tell us about your perspective?
Yeah, absolutely. Well, thank you so much for you guys as researchers bringing in all of that data. I think that helps to really set the picture of, lived experience. But yeah, I touched the system at birth due to intergenerational issues with my biological parents. And I was placed into the foster system at birth. About 7 months later, I was officially adopted. Two foster parents stepped into the picture, and then I was adopted. I was adopted transracially in Southern Utah. So as you can imagine, that really was hard for me. And I'll talk about it later, but that really affected my mental health from a cultural perspective, being adopted transracially. Because of that, I struggled with my mental health, became super antisocial, depressed, anxious, and I didn't know the words for it. I didn't know what I was feeling at the time, but a lot of my parents and the professionals in my life weren't looking at the trauma that was impacted by on me, but they were looking at me as a youth who was acting out, as a youth who was not listening to the parents and the systems that they wanted me to follow. Due to that, I was placed back into the system at 15. And during my time in the foster care system, I was in congregate care. For those of you who don't know what that is, that's residential programs, group homes, mental health facilities. And so as you can imagine, I've had a very extensive increased mental health care from that perspective. And a lot of it that I experienced was definitely kind of like Yusef was talking about. You're either over-medicated or under-medicated. For me, I was over-medicated. And like I mentioned before, a lot of those things were I was overdiagnosed and I didn't need to be on these certain medications that quite honestly were, not doing anything but declining my mental health in a lot of ways, once again, because they weren't addressing the actual root cause of my behaviors and my trauma. I later then aged out of the foster care system at 18. My biological or my adoptive family was in the picture a little bit for me, but as you can imagine, that ties of the cutoff of that family dynamic was very hard for me. And so the relationships have just been severed since then. But we'll talk about it later on. But yeah, as you can imagine, aging out of the foster care system all by yourself and with little support was very difficult for me. But yeah, that's, I think that's kind of my perspective on this data for sure.
Yeah, thank you. Thank you, everyone. I'm really struck, both Yusef and Cadon, in your remarks. As researchers, we tend to focus on being involved in the system, or the sort of backstory of how you got involved, having a long run effect on mental health or other outcomes, without so much thinking about the experiences that you have while you're in the system. And both of you are highlighting experiences that you had within the system, and specifically being underdiagnosed, overdiagnosed, under-medicated, over-medicated, things that would specifically contribute to mental health problems. So I really appreciate that point, and I'm very grateful to you for raising that. If I can come back to both of you, just can you say more about how your experience has informed the work that you're doing? How you think your experiences should or might inform the work of other researchers or practitioners or policymakers, and specifically as you think about the work in this area, what are the gaps or misconceptions that you see? What do you think that researchers, practitioners, and policymakers misunderstand or get wrong?
I would say, yeah, those are some really great questions. I'll kind of start with the first one of how my experiences informed my work. Like I mentioned before, obviously being adopted at birth, being placed back into the foster care system, and then aging out. I think I had those three connections to the child welfare system that really gave me like a vast perspective on how the system works from that lived experience. And so, yeah, I think really just the lived experience of it all has really informed the work that I'm doing now. I think the second question you had was how others, or how might your work inform others, researchers, practitioners, policymakers. I think lived experience is super powerful, and I think it's essential, especially when it comes to data and researchers. I think there's an opportunity to go beyond quantitative outcomes and understand the nuances of what actually is working and what's not working. So I think Tia and Lawrence for stating those things that, a lot of it I actually didn't even know until now. But I think for practitioners, it's also good to remember that youth are not just cases or check marks. I think they're full people navigating trauma, identity, and transitions out of the foster care system. I would say for policymakers, it's a call to action. It's a call to redesign systems. I think the most impact when it comes to that is our insights and how we shape responsive cultural competency when it comes to the child welfare system. And so, yeah, I would say those are kind of some of my suggestions when it comes to that lived experience.
It was a lot of questions there. What was the question again?
So one question is, how has your experience informed your work? How might it inform the work of others, researchers, practitioners, policymakers? And what do you think that researchers, policymakers, and practitioners get wrong? What do they misunderstand, or what are their gaps in knowledge? And you can answer any or all or none.
Okay, I'm gonna just do the best I can.
Yeah.
So I would say, first off, kind of to piggyback off what Cadon said, my lived experience has basically propelled me to put me in positions and given a different lens to people and policymakers that they wouldn't be looking at. So I've been on every spectrum that you can think of when it comes to child welfare. I've been in and out of care. I've been adopted. I've went from foster care to juvenile penitentiary. So I've experienced every aspect that you can really from care. So when I transitioned and started becoming more of an advocate in advocating for policy change, it's been a big change, because I'm given insight to what actual life is like, what I've actually lived. I've actually lived behind walls. I've been to 100 foster homes, and when someone asks, they're like, "Hey, what is it like being in foster care?" I always just tell them, "Hey, go pick one of these random strangers and you go live with one, and that's what it's like being in foster care." So it's just that perspective that I'm able to give them, and I'm able to give recommendations that benefit other people. So it doesn't benefit me anymore because I'm not in care. So it actually benefits the younger generation. So that from that perspective. I don't know what the other questions were though. I forgot.
Yeah, no, that's great. No, that's great. I'm checking to see if there's any questions from the audience, because I want to be sure to bring people in. So there's one question, which is for those the participants who experienced the foster care system. What coping mechanisms did you use to cope with those experiences? Like, how did you make it through? Did you ever have someone who helped you out? I mean, was there a mentor, an advocate, another supportive adult who helped you out? And related to that, if the child welfare workers, foster parents you interacted with could have done just one or two things to support you, what would you have liked them to have done? So how did you cope? Was there anybody who helped you out? And thinking for the kids who are in care now, what would you say to their child welfare workers or their foster parents? What could they do to better support them? And again, any or all, you know what I mean? Or you can pick any of those questions.
Yeah, I actually wanted to jump back just a little bit to highlight something else that I think is very important. Yusef talked about, being in 100 different placements before he was adopted, and the instability that was there. I kind of want to just talk about after you're adopted. I think there's a major misconception that permanency through adoption automatically leads to healing and stability. I think the reality is many of adoptions break down or are unsupported, especially without post-adoption services. I think another gap is the idea of trauma-informed care. I think we need healing-centered, culturally relevant approaches that move beyond pathology and medication. I think too often systems react instead of are preventative. I also think there's a disconnect between youth voice and real power when engaging with young people. But yeah, I just wanted to share that quick thing. But Yusef, if you have a response for those other questions, that'd be great.
That's great response. So to kind of answer the question, what coping mechanisms, I think that was a question.
Yeah.
I didn't, when I first got in care, I didn't have any coping mechanisms. And that kind of was a lot of the problems, because I didn't have any control as a young 5-year-old. When you in life, for me, when I woke up every day, all I knew was my mom, my sister, and that was it. And so when that environment got taken from me, there wasn't any coping mechanisms. It was anger. I was mad. I wanted to go back home. So eventually, later in life, I developed a village, and that consisted of my school teachers, of my aunt, and of my foster family. And that's what kind of propelled me to start to mature. And I just woke up and I was tired of the system, and I had those mentors in my corner, and that's what really took me to the next level, and made me change my perspective. And we all know perspective is reality, and once my perspective changed, my life changed.
Yeah. Wow. No, it's a great answer. Yeah, so we now have a lot of questions coming in, a lot of comments in the chat that I encourage everyone to look at. We also had a couple of questions for the researchers and or for everyone on the panel. So what conclusion are you drawing about the impact of child welfare involvement? Are you in a place to draw a conclusion that globally it's has a negative impact on mental health, or it has a positive impact on mental health, or does it really depend on the situation? And there was also a question about, so do you have any thoughts about changing the system, for example, getting rid of mandated reporting, or some of the changes to the system that have been proposed so that not so many families are brought into the system? And I'll try to refrain from answering that question myself, but I might reserve the right to do that.
I can go ahead. I think those are some very deep-rooted questions, especially when you're looking at the child welfare system historically. And I won't go into all of it, obviously, but I would say my perspective, my lived experience, and what I think is going to vary for every case-by-case basis. I think for me, I'm like nervous to say it. No, I think the child welfare system I think its intentions are good. I think obviously, the goals and the perspectives that Lawrence brought at the very beginning, I think those are good. Obviously, keeping families together, protecting vulnerable youth, that's great. I think the actual implementation of it sometimes falls short when actually addressing the concerns for youth. I would love to be up here and talk about how my experience was great. My adoption was perfect. Going back to the system was amazing, but in reality, it was a waste of my time. And I think it failed my parents, adoptive and biological. And I think it failed me in a lot of ways. And I think it really made me struggle with my mental health even more. And then what was the other follow-up question with that, Jane?
Well, it was a similar question of do you see a need to overhaul the system, radically to change mandated reporting or
Yeah. Honestly, that's a great question, honestly. I feel like being an advocate in this space comes with so many difficulties, but I'll have to come back on that one, honestly.
Yeah.
I haven't really given that one much thought, but like I mentioned before, I think the implementation of it definitely needs to be changed, and we need to definitely be readdressing some things.
Yeah.
So if I can hop in to answer your question in regards to, how we can sort of change the system to improve it. As I mentioned before, I started off looking at incarceration and how it affects families. And when I looked into the child welfare system, it was unsettling the similarities that we see. And both systems tend to engage with families that are already facing adversity. And one of the things, just as a culture, which I see in the US, is we tend to deal with, poverty and families in need of help in a very sort of punitive manner. And we can see that in how these services are implemented, and really sort of shifting our perspective to not sort of punishing families for being in the position that they're in, but really reshaping how we engage in the sense of how can we provide more support and more services. It would be a very different conversation if CPS had these extensive resources that once they engage with families, they were connecting them to excellent health care and excellent mental health care and providing employment or whatever other supportive services that these families and these parents truly need, but that's not what we're seeing. And so I think this is what's shaping the outcome. And, thinking about longer term, how these interventions will impact families. If there is suspicion of abuse in a family, understanding how removal and separation from families can truly impact the children that are involved, and taking that type of time and care and thought and how we're addressing these issues. I think of things like, trying to ensure that the child has a way to stay with their family. Cadon spoke to being in a situation where he was raised by a family of a different ethnicity. These are the type of things that need to be considered. And, the environment that the children will be in once they've engaged with the system. And so I think it takes more thought. It takes bringing more people to the table, including those with lived experiences, including those that are already from marginalized communities, to really voice what their experiences are and what they actually need for help and support. So those are just my thoughts.
Yeah, thank you. I want to just come quickly back to Yusef because I know he's gotta leave. So any final thoughts that you want to leave us with before you have to leave?
No, just thank you. It's grateful to be here. It's been a blessing and talking to you all, and let's go Soul Family.
We're so grateful to you for joining us, Yusef, and we clearly could have talked for another hour. So we might reconvene the group in the fall. We'll see.
Thank you, everyone.
Thank you very much. So, we've been talking today about mental health, and it's been a really fabulous conversation, but there are so many other outcomes that one might look at. So let's just do a quick, couple minutes going around of what else are you interested in looking at when it comes to outcomes for kids who've been in the child welfare system, and well, I guess maybe why, but yeah, what's up next?
So I'm happy to start on that. I think, and this actually goes back to your last question, Jane, and to which I agree with both Tia and Cadon. On Cadon's point about it's very individualistic, I think it's very hard to say, does the Child Protective Service system help or hurt kids in general? It matters so much about, what their past experience has been, what kinds of care they get in the system, how deeply they're into the system. I just think there's a huge amount of variation, and on what outcomes. So I think, mental health clearly, important. I think we also want to look across, life's trajectories. So education, employment, family formation, family functioning, criminal justice involvement. I think there's this whole host of pathways that could be affected by these systems that are really important to get a better understanding of. And including, all of those things have implications for how this may play out intergenerationally to people's own kids, which, the Future of Families is now about to collect data on the next generation, the kids of the kids. So that'll offer some great opportunities.
Yes, I can go next. For me, as I continue this work, I see opportunities to expand beyond mental health and examine additional outcomes, just like what we've just heard, that speak to broader dimensions of well-being. And so, looking at outcomes like physical health and health-related behaviors like drinking and smoking and other indicators of functioning in early adulthood. And to go along with Lonnie's point, I am interested in how these outcomes are shaped by the various levels of intervention and the timing, the type, and the intensity, to see how those different types of engagement with the systems might affect those that are investigated in the long run.
Cadon, there's a couple of questions in the chat about the role of health insurance, the importance of health insurance, and in particular Medicaid. So I'm going to hand that question to you.
Yeah, great question. I think when it comes to youth in foster care, I think Medicaid is that primary insurance for the majority of youth in foster care. And so I think obviously, yeah, I wasn't sure what was the specific question. Medicaid is very important, obviously.
The question was really how important is health insurance? We haven't really talked
Oh,
about health insurance as being important for kids either in the child welfare system or coming out of the child welfare system, and in particular Medicaid. And so I couldn't resist tossing you that question, given the vote this morning in the House to impose work requirements for Medicaid, and which is going to end up bouncing an awful lot of people off of Medicaid.
yeah, absolutely. Medicaid is absolutely important. I spoke at a press conference in DC a few weeks ago, and I talked about how it saved my life. So I think Medicaid, especially for youth in foster care, is a lifeline. I think, there's so many benefits to Medicaid that impact the lives of children in the foster care system. I think there is no question of how important it is. And so when it comes to legislation and policy, I think that's something we, need to continue to push for, especially, addressing it when it comes to youth in foster care. But I kind of wanted to touch on Tia's point, just looking at the future of what we want to dissect when it comes to the child welfare system. So I think my end goal is to get my PhD in clinical neuropsychology, and then I want to work with youth impacted by the child welfare system. And a question that I always ask myself and other individuals that are advocates is, how am I here? How did I make it? And why am I at the success I am at right now? I think for me, my interest really comes in between the neurobiology and neurophysiology, and examining how the child welfare system influences your mental health, et cetera. I think through that potential research, I want to seek to understand the mechanisms that shape human behavior and resiliency, and hopefully aim to help people recover from their mental health, physical health. I think there's so many implications of, the biology of your body that happens that we don't understand, that impacts, your body holistically. And so I think that's, something that I want to potentially research when I get to that level. So.
Yeah, we can't wait. That's great. Lonnie, there's a question that sort of has your name on it in the Q&A. How are you measuring CPS contact in Future Families and Child Wellbeing study? And I think the question was kind of assuming that there wouldn't be any direct information about child welfare involvement, and that it's being proxied by child abuse and neglect measures. But that's
so what's
not actually
interesting,
the case.
that's not the case. So we don't have links to administrative data, to official records of Child Protective Services involvement, but we do have families' self-reports of being involved with Child Protective Services at each of the waves throughout childhood. We also do have measures that are proxies for actual abuse and neglect, and those are provided both through parents' reports of their own parenting behaviors, both physical and neglectful behaviors, and also by some observations by the interviewers when they're in the homes. The thing to recognize about the Child Protective Services self-reports is that we know that they are underreported within within the Future Family study. And it turns out that the slightly more advantaged families are less likely to accurately report having been CPS involved when they were. So they say they weren't, and when they were. So we've worked with a Bayesian statistical framework to really correct for or adjust for this underreporting, so that we can predict the probabilities that families were actually reported, even if they didn't say they were reported. And so that really opens up an improved way to use these data to look at relations between CPS involvement and well-being.
And I should say the Future Families Child Wellbeing Study data, it's a publicly available data set hosted at Princeton University. I think our last count is that close to 10,000 researchers have used the data. So it's used by a lot of folks. And as Lonnie said, we recently released the age 22 data. So we have data from birth to age 22. And we are going to be in the field next year, starting to collect the age 27 data. So I really encourage people to check out the Princeton website if you're interested in using the data. And we also always like to thank our funders. So we've been funded since the children were born by NICHD, a branch of the National Institutes of Health, and probably about 20 foundations. At age 22, we're really grateful to the Annie E. Casey Foundation, the Gates Foundation, and the Hilton Foundation, who's supported the analyses that we talked about today and the work that our team is doing. And as I said, this is the third in a series of webinars we've been doing this spring, and we hope to do more in the fall because the work on the young adults is continuing. We'll post the recording from today on the Center on Poverty and Social Policy website. Yes, Cadon, we'd love to have you get involved in the research. That would be fabulous. We would also love to have you come back and have Yusef come back. You can find the recordings from the prior 2 webinars on the CPSP website, but we'll also post the recording from today. We'll share how to contact panelists. Please reach out to any of us if you'd like more information, if you'd like to talk further. And as I said, we do hope we'll do more events like this focused on young adults in the fall, so stay tuned. So yeah, what haven't we talked about? What last thoughts would you all want to be sure to make before we end today? We've got 6 minutes, so you've got 2 minutes each.
Okay, so I want to pick up off of there was the question about Medicaid that Cadon answered, and kids who go into foster care get Medicaid. Not all CPS involved kids get Medicaid. So Medicaid for foster care kids is incredibly important for getting physical health care, mental health care, behavioral health care. But I think one of the things we didn't talk about today is preventing kids and families from getting involved with Child Protective Services to begin with. And I think the larger policy landscape is incredibly important there. So, the ability for parents and children to get these kind of physical, mental, behavioral health services could help prevent involvement with the system. There's strong evidence that income support policies, that policies that enable families to increase their material and economic resources help prevent getting involvement in the Child Protective Services system. So there's sort of 2 questions. One is, how do we help families be safer before they come involved with the system? And I think the larger policy and services landscape is incredibly important there. And the second piece is, once families do get involved with the system, how do we make the system serve them better? And so I just wanted to bring up that front of the the bigger prevention context.
Yeah, super important. Thank you, Lonnie. Tia, do you have any closing thoughts?
Sure. I believe there were some comments about people getting more involved and, how they can use this in sort of real world settings. For one, I'll say, as a researcher, I do my absolute best to never forget that the statistics that I'm looking up are attached to actual people and their actual experiences. And I try so hard to uplift those experiences and truly respect that. And again, I thank you, Cadon, for being here, and Yusef, even though he had to leave. And also, I want to add that I believe this work doesn't just belong in classrooms or academic journals. As researchers, we have critical roles to play in partnering with policymakers, with advocates, and most importantly, the communities that are most affected by what we are actually examining here, and how to translate these findings into meaningful action. And so this does mean continuing to collaborate as we're doing here, and working with those that are most affected with the system as we're working to change it. As we just stated, how do we improve the system such that when you're engaged with it, that it actually does create better outcomes for the children and the families that are involved, better preventative service so that they're not engaged to begin with. And then also finding more creative and accessible ways to even share this information as researchers and as advocates. And so whether that's through, public briefings or op-eds, digital storytelling, community-based forums, whatever, just to sort of get this information out there so that we can garner more engagement with communities and other individuals to come up with better answers and better solutions to the problems that we're facing. So thank you.
Thank you, Tia. Cadon, you get the last words.
Yeah, honestly, Lawrence and Tia perfectly summed it up. Those are the two things I would have talked about: prevention, and then also just tying in that the data that we're looking at is actually lived experience and people that are living to this day through those experiences. So perfectly said. I don't need to repeat myself. I just wanted to thank everyone for this experience. And I also wanted to say that this is a perfect segue into this month, which is Foster Care Awareness Month and Mental Health Awareness Month. So I just wanted to highlight that. But yeah, thank you so much for everyone who tuned in, and I just appreciate this opportunity.
Well, thank you all. This has been a fabulous conversation. And I want to thank the participants because the comments in the chat and the questions have been fabulous. And I do feel like we could have easily talked for another hour or so. And I know these are busy times and they're also difficult times. So I just appreciate everyone just making the space and making the time to be here today and for this conversation. So we'll get the recording out as quickly as we can. And I hope we'll have a chance to do this again because this was really terrific. So thank you, everyone.